want to do it, but circumstances dictated it. And so you're going to find that your role is different. You're a child, you're a spouse, you're a granddaughter, you're a son, but all of a sudden now you have to take that in the context of being a caregiver for someone who's beginning to lose control of what their life is about. I absolutely think this is the most difficult illness for caregivers. You know, cancer and heart disease and all those things are very difficult to cope with, but it's different when you've got somebody who you can sit down and you're making decisions jointly. You all are in a situation where you've got a disease that's attacking the person's thinking capabilities, and all of a sudden you're finding yourself stepping in, and I heard several of you mention it, you know, how do we get the car away? How do we look about having or not take a silversmithing class? Where do they live? These are big, big, big decisions, and all of a sudden you find yourself in the position of looking at making those decisions. Many times with a person who doesn't realize that those decisions need to be made and will tell you no and be quite defiant about it in the process. So this feeling of being kind of overwhelmed and not sure what you're doing, and depression, all of these things are pretty normal things that caregivers experience. And we know with people who take care of somebody with dementia, the stress and strain of being a caregiver is worse. About 80% of older people in general are cared for in the community. You know, we kind of have a myth in our society that everybody's in a nursing home and nobody goes to see them, and you know, it turns out that really isn't true. So, you know, the vast majority of older people, and the vast majority of older people who have a disease that attacks their brain, are in community settings with their family members taking care of them most of the time. This class is a little bit different than what I normally see because the statistics tell us that about 70% of caregivers are women. So it's really nice to look out here and see male caregivers, because very often when I teach this class I don't have a single male caregiver who's in the class. So you guys are somewhat different. But historically this is a role that falls to women. And usually in most families there is a caregiver, even if there's lots of other people available. So the two of you that are feeling kind of particularly alone in this caregiving role, it's what happens a lots of times, that, you know, somebody in the family gets elected to be the caregiver. And a growing percentage of caregivers also take care of children. And I don't know if any of you are in that situation where you have kids at home or grandkids that you're caring for, but that's often something that we see. We know that people who take care of a person that has a brain disease, that you're twice as likely to have physical or psychological problems. You're more than twice as likely to use medication for depression. You're at much higher risk for social isolation and economic distress, and only half as likely to use health care. You know, you make sure your family member gets to the doctor, but you never quite have time to get yourself to the doctor. So part of this class is learning to take care of yourselves, because if you don't take care of yourselves, there's no one around to take care of your family member. You know, all of you are kind of in this alone. Even where I've got situations where you've got other family members here, you know, it's the two of you taking care of your dad and mom. So taking care of yourself and learning how to get help and resources is a really important thing. And I'm very glad to hear that you guys have kind of hooked up with some resources. And I know Kim, your mother-in-law, is hooked up with Total Long-Term Care. And for those of you who aren't hooked up with some services, this may be the time to think about getting some additional help in to look at some of these decisions. And we're going to talk about that as we progress in the class, because this is a situation where you often need help. In fact, I would say most of the time you need help. You can't do this all yourselves. It becomes too overwhelming. Okay. Any questions about anything we've talked about? John?
Should we have this discussion with our parents that we're learning about this, or should this just, I mean, are they going to, you talked about resentment from the parent. My dad would be resentful if I told him what to do and he didn't agree with it. So I know you're going to teach us how to respond to him, but the whole class, should they be here with us, or?
They should not be. This is a class for caregivers. And I'm going to delay kind of addressing your question until we kind of get at the end.